Prof, so the president says we should not panic. What do you reckon?
So I fully concur. I think we need to be very measured in terms of the manner in which we approach a single case. So without wanting to undermine the significance of the event, at the same time we need to put it into context. And the reality is that the chances of a single case resulting in a huge outbreak of coronavirus, an epidemic of coronavirus in South Africa, is fairly limited at this point in time. It doesn't mean it can't happen in the next week, in the next few weeks. But what we need to do now is we need to be calm and collected. So when we think of coronavirus, we need to put it in the context of the broader public health issues facing South Africa. The reality is, this year alone, there's between 4,000 and 10,000 people that are going to die in South Africa from a viral infection. But that virus is not coronavirus, it's influenza virus. Now, the transmission patterns of the coronavirus is, in fact, less efficient than the transmission patterns of influenza virus. So a person is more likely at this point in time with the single case in South Africa to die from influenza virus in the next few months in a winter period than a person is likely to actually contract coronavirus. So we really need to be calm and collected in terms of how we approach this, both from a media perspective as well as in terms of what the politicians are trying to do in terms of promoting an agenda, trying to show that the state is not actually prepared to actually deal with what we're actually facing at this point in time.
All right, so you reckon the state is prepared. Now, for the people who are panicking in Durban, as you just heard from ordinary citizens, what should they keep in mind knowing about how this person is going to be treated?
Right, so the state is prepared at this point in time in terms of being able to manage these isolated cases of coronavirus. If there's a huge epidemic, if there's a larger epidemic, then the entire dynamics in terms of how we go about managing is going to change. At this point in time, with a single case in Durban, the risk of the general population in Durban actually becoming infected is very limited. Obviously, what's happening right now, as you've reported, is that the NICD is going out with a task team to identify what are the contact patterns of this individual with other individuals that this person may or may not have actually infected. So that part of it is an important piece of the puzzle in terms of being able to contain what we see as a single identified case right now. But should there be more cases, the dynamics change. Now, the previous person that just was on your report indicated a very important thing, that in terms of what South Africans should do to protect themselves. The first thing you need to do, you need to be going down to fundamentals. And the most common way in which this virus probably infects someone is by you not washing your hands. So someone coughs, sneezes, there's droplets that are spread in the environment. You go by, you touch those surfaces, and then you wipe your eyes, as an example. And that's how you're going to infect yourself. The other way you're going to infect yourself, if someone is coughing and they cough directly into you, and those droplets come into your eyes, into your nose, you breathe it in, you're going to infect yourself. So it's important to avoid people that are coughing. If people are coughing and sneezing, on their part, it becomes their responsibility to actually prevent them infecting others by wearing a face mask. Yeah. But for the general person, what they need to do, they need to be obsessive in terms of how they go about washing their hands and preventing themselves from becoming infected through their own doing. Yeah. Now, this is not unique to coronavirus. The same thing applies to influenza virus. The same thing applies to influenza virus. Yet, like I said, 4,000 to 10,000 people are going to die of influenza virus this year in South Africa. We've got a vaccine for influenza virus, yet less than 1 million doses of vaccine are used each year in South Africa against influenza virus. So we need to put the coronavirus into context in terms of what else is happening in South Africa.
All right, thanks for the context, but that's not going to stop people from taking extra precaution, right? We're going to see many people using those masks on the street. We saw somebody in Durban actually put one on right now. Is it very effective or not?
So there's no data to show that someone that's not infected would actually be protected to the mask. That person that's wearing a mask, if they're not careful in terms of hand hygiene, if they touch a contaminated surface, don't wash their hands and wipe their eyes, they're equally likely to get infected with a coronavirus than had they not been wearing a mask. Yeah. The mask is actually more important for individuals that are symptomatic, that are coughing, that are sneezing, to prevent them from actually spreading droplets which might have the virus and then contaminating surfaces in their vicinity. So individuals that are coughing and that are sneezing and that have got respiratory symptoms, it's more important for them to be wearing a mask. For the rest of the population, it's more important for them to be doing basic things such as washing their hands when they come into contact with people. What you need to be doing to avoid the infection is you do not shake hands with someone that has just sneezed and sort of covered their mouth with their hands. You're going to invite yourself being infected.
All right. Thank you so much for your time and your insight. Appreciate it. That was Shabir Mahdi from the University of Witwatersrand.